Hello, this is Dr. Claudia Cotca from the Washington Institute for Dentistry and Laser Surgery. Just want to say hello to you and just bring you a word of encouragement to our existing patients. Some of us have been in touch. We want to just say you're doing great, keep going, you've done well, and you're going to get through this. And that's a wonderful, wonderful feeling to have. To our patients, to our non-patients and consumers and partners, we want to say thank you again for helping us through this crisis, and we wish you and your families and your communities the very best as well. And we want to also encourage you in the same way. However, for individuals who, for instance, have not had the privilege or the opportunity, for instance, to have access to our oral hygiene instructions, we want to just share that with you. And very briefly, I'm going to start by just saying that systemically, the immune system is one of the most important components within the systemic profile. So as we combat any type of viral loads or bacterial loads or whatever they are, in whatever concentration, for whatever amount of time, in whatever mode of delivery, either be it, of course, the eyes, the nose, the mouth, these types of exposures ought to be perceived as opportunities to be mitigated, meaning the oral hygiene instructions that we recommend at DClaserdentist Dentist can serve, I believe, a wonderful source of information and opportunities for you to protect yourself, not just now in a crisis, but also apply this in your regular lifestyle. So I'm going to just go through some of the major components, and I'll start off with saying that electrical toothbrush is always optimal given the scenarios. Perhaps you may not have one accessible. My favorite is Oral-B. It's because of the fact that the brush head itself can isolate one tooth at a time approach rather than a segment. However, if you don't have available that at this particular time, you can certainly have access to it in the future. Use what you have. Soft bristles are always more ideal. It's about ensuring that you're not damaging the tooth structure or the tissues with the unchecked pressure. When you brush your teeth, ensuring that you're also brushing your tongue, making sure that everything that is white, yellow, or whatever color on the surface of your tongue is removed, and the surface of the tongue has to be as pink as the tip of your tongue. In addition to that, flossing and brushing within 15 minutes after your meals is the most ideal. Certainly, simultaneous is the excellent option, but when those cannot be applied, alternating between the meals to have either the floss or the brush can serve absolutely well as well. In terms of my favorite adjunct rinses include the ACT, ensuring that does not have alcohol in the inactive or active ingredients. And of all the flavorings out there, I would suggest mint. Addition to that, the tooth and gum tonic serves a wonderful composition. It's all natural, but it is HPLC grade, meaning that it's an excellent quality. And there's several components there that have been actually tested and have shown that they're just as effective as equivalent antimicrobials available on the market in some of the products that we have seen. In addition to that, ensuring that you are enjoying your time with your family and friends, given the opportunity that we have, will also serve as an encouragement to implement more optimal health practices. And we want to encourage you to do that. Some of the adjunct recommendations, particularly, for instance, there's bleeding that's noticed, or there is sensory that sensation that the tissues may not be as optimal, and there's sensitivity. Of course, contact your interdisciplinary team and stay in touch with them and update them and follow their recommendations. But the at-home go-to can also include warm salt water rinses. What I mean by that is not microwave water, but rather boiled water. Certainly wait for it to calm down so that you don't burn your tissues. added kosher salt or sea salt water would really allow for a very nice intervention in terms of optimization, revitalization of your own cellular tissue layer, but also a more calibration approach to whatever it is that that you're dealing with in terms of an abnormal concentration or whatever impact that you're going through. Additionally, medications can cause singly handed as well as in combination, either as additive or synergistic impact in modifying the quality and the quantity of saliva. And it's important to have the appropriate type of saliva and the appropriate amount, particularly as you're combating this aspect of staying healthy, staying optimized, and ensuring that you're not susceptible and you're not allowing any type of exposure, whatever the concentration be it, and that you're taking steps to mitigate that and eliminate it. So I hope that this has served you information that will serve you well. We wish you very best from Washington, D.C., and we certainly look forward to seeing you healthy.